I'm Arshad Khanani, and welcome to Recap. Today, I'll be bringing you highlights on macular degeneration from this year's annual meeting of the Association for Research in Vision and Ophthalmology. The first abstract I want to cover is the 2-year results from the Truckee study. As you recall, Truckee is a real-world collaborative non-pharma-supported study looking at efficacy and safety of faricimab in patients with neovascular AMD. In this study, the authors presented data from 3,412 eyes and concluded that faricimab inhibition of VEGF-A and Ang-2 continues to demonstrate rapid improvement in anatomy in patients who were previously treated as well as patients who are naive, to significant decrease in retinal fluid volume and extension of treatment interval in all patients, including the tough-to-treat patients with a chronic disease. And the benefit of faricimab continued with continuous treatment, leading to better anatomy and durability over time. And obviously, safety is important. The study highlighted that patients treated with faricimab, the risk of intraocular inflammation was comparable to what's seen in clinical trials and is comparable to other agents, and they did not notice any cases of retinal vasculitis in this cohort of Truckee patients with 16,682 injections. The other abstract I want to cover is relating to pegcetacoplan. As you know, pegcetacoplan has been FDA approved for geographic atrophy February of last year, and as a field, we want to see the long-term data. So Abby and all presented the long-term data from the GALE extension study, where patients who were treated with pegcetacoplan for 2 years are continuing, and patients who were treated with sham for the first 2 years are also getting pegcetacoplan at the same interval, whether monthly or every other month. And they saw increasing efficacy through 36 months in these patients. Pegcetacoplan reduced GA growth during month 24 to 36 and delayed progression to severe visual impairment. And the safety profile of the GALE study, which is the extension study, appears comparable to what we have seen in the primary Derby and Oak study, including low risk of intraocular inflammation, also small risk of ischemic optic neuropathy, and increased risk of choroidal neovascularization. And lastly, they presented an update from the real-world usage of pegcetacoplan with over 215,000 injections done in the real world. They concluded the rate of retinal vasculitis remained around 1 in 10,000 per injection and appears to be first injection phenomena in about 1 to 4,000 patients. So something to keep in mind if you use pegcetacoplan in your clinical practice. And last abstract I want to cover is with avacincaptad pegol. Here the authors look at the efficacy of avacincaptad pegol in the pool analysis of GATHER1 and GATHER2 over 18 months. As you're aware, avacincaptad pegol is also approved for geographic atrophy as of August of last year, and it's a C5 inhibitor. And in the clinical trials, the pivotal study GATHER1 and GATHER2, we saw a treatment effect that increases over time. And what they concluded is this post-hoc analysis demonstrated efficacy of avacincaptad pegol 2 milligrams in reducing GA growth versus sham over 18 months, regardless of dosing frequency. And what they also noticed is that there was almost doubling of treatment effect every 6 months through 18 months. And safety obviously has been very acceptable for avacincaptad pegol in the clinical trials, with only one case of vitreous cell in GATHER1 and in GATHER2 that were very, very mild. And we have not seen any cases of retinal vasculitis in these trials. So they concluded that the safety also in this pool analysis looks good. So to recap, Truckee study showed the efficacy and safety of faricimab in a real-world setting. GALE study showed continuous benefit of treatment with pegcetacoplan, and safety appears to be similar to what was seen in the phase 3 Derby and Oaks trial. And lastly, pool analysis from GATHER1 and GATHER2 over 18 months showed continuous benefit of avacincaptad pegol with almost doubling of effect every 6 months with very good safety profile. Thank you for your attention. Goodbye.